Welcome! In this video, I will talk about what is healthcare administration. Hi, my name is John. If you don't know, I used to be an EMT in Los Angeles before I transitioned over to work in a trauma hospital, psychiatric hospital. I have about 10 plus years of experience in the clinical side. Recently, I transitioned over to healthcare administration after getting my Master of Healthcare Administration. So let's jump into the topic. What is healthcare administration? One of the biggest takeaway of healthcare administration is that you get to know a lot of people. The main reason is that you have to get involved with a lot of different departments and teams. The best way to represent healthcare administration is think business administration, but very healthcare industry focused and the niche of healthcare. For example, let's take finance. So every business have financial department. So there's of course there's a basic of income, revenue, liability, cash flow. But for healthcare administration, you also have to deal with insurance, reimbursement, contract. So let's take reimbursement for example. With healthcare, there is HMO, PPO, and many other plans. But the main one you probably heard of is Medi-Cal and Medicare. In my opinion, I believe that healthcare administration is one of those unique industry that you can learn a lot and get a lot of skill because you can transition from one department to another. For example, let's say you are working in the finance department. After a while, you could transition over to marketing. If you want, eventually you could transition over to consultant or IT. So there's many route that you could go about after you go from one department to another. However, it can be a grind though because it takes time to learn, and usually you have to start from the bottom and work your way up to the top. For example, let's take finance, right? For some people, they usually start out as administrative assistant, and then they slowly work up to the coordinator, and then senior coordinator. Then eventually, you get your master and you become a manager. But it does take time, and you have to work your way up. I know that some of my friends, they want to explore what they want to do with their career. So some would start out in HR and then go to marketing. Some would start in finance and then they eventually go to IT or go to consultant route. So again, because healthcare offers so many different routes, but I want to emphasize that it does take time to learn and build up your skill, and usually it can be a grind because it's a lot of work. And when you get to your mid-tier professional level, let's for example, let's say senior or manager or VP, usually most companies expect you to know different department because for example, as manager, you want able to know how the HR work, the finance work, the marketing, and then the reimbursement. So let's say if you're a manager of operation, you kind of have to know a little bit of everything from different departments so you can manage your team well. Do I need a bachelor or master degree to start healthcare administration? First of all, you do not need a bachelor or master to start your healthcare administration career. There are a lot of people in the US right now that start out as the bottom and they work their way up. Usually people start out as administration assistant to see if they are fit for the healthcare administration career. My recommendation for you right now is if you are interested in healthcare administration, try to volunteer in a hospital, see how it is with the healthcare administration, talk to people in the hospital, talk to people in the healthcare clinic, talk to the administrator, see if the healthcare administration is the right fit for you. Because when you volunteer or you when you intern, you kind of learn how everything kind of works and if it's the right career for you before you invest your time and money, especially money, because bachelor and master can cost you a lot of money. And if you do it and you don't like the career after you get your degree, it doesn't make sense. Therefore, it's best for you to volunteer or intern for a few months and see if the career is right for you. Personally, for me, I have 10 plus years of healthcare experience. So it makes more sense for me to get my Master of Healthcare Administration, MHA degree. and then transition over to healthcare administration. Eventually, I want to get into management. So it makes more sense for me to get a master's degree. But for you, I recommend you to explore and see if healthcare administration is a right fit for you. My tips for healthcare career. If you can network, it will really help you to get a job. But it's 100% doable if you to get your foot in the door by getting a lower paying entry-level job. Learn how to manage and communicate with people. Respect is the key. Learn how to talk to your co-worker, different department, your team lead, and your manager. They will help you learn and kind of build up your skill and experience. In the early stage of my career, I have worked in environment where people would throw you under the bus if something go wrong. Therefore, that's why I really recommend you to network and build up your references and be respectful to your coworker, your manager, your team lead. And eventually, if something does go wrong, which in healthcare, something will always go wrong, you will have someone to be there and back you up. Just FYI, depending on the seniority level and the company that you work for, sometimes you have to be on call and have to work after hour as a healthcare admin. Again, I don't want to scare you from the healthcare administration career, but the reality of the situation is this. Healthcare is 24/7. Your patient care doesn't stop after 5 p.m. Sometimes you have to work after hour to finish the work that assigned to you. And depending on the seniority, sometimes you have to work on call and work on the weekend. My final advice is this. Please do volunteer, do internship, or even get an entry-level job in a busy, hectic healthcare environment to see if healthcare administration is the right career for you. Because you don't want to invest your time, energy, and $1,000 or even $100,000 into debt just for a bachelor or master degree. Just find out that at the end of the day, you have no passion for healthcare administration. So please do a test run, try it out, get an entry-level job, see if healthcare administration is the right fit for you before you invest your time, energy, and money into this career. That's my final advice, and best of luck. Well, I hope you learned something new from this video. What is your thought on healthcare administration career? Please comment down below. Let me know what I did not talk about, what I should talk about in my future videos. And if you learned something new from this video, like and subscribe. On this channel, I talk about my thought, my experience in the healthcare field. Well, I hope you have a good day. Take care of yourself, and I will see you again on next video. Bye!